Major depressive disorder. Major depressive disorder is a common and serious mental disorder that negatively affects how you feel, think, act, and perceive the world. Nearly 3 in 10 adults have been diagnosed with depression at some point in their lives, and about 18% are currently experiencing depression, according to a 2023 national survey. Women are more likely than men, and younger adults are more likely than older adults to experience depression. While depression can occur at any time and at any age, on average it can first appear during one's late teens to mid-20s. Symptoms of depression can vary from mild to severe and can appear differently in each person. These symptoms can include 1. Feeling sad, irritable, empty, and/or hopeless. 2. Losing interest or pleasure in activities you once enjoyed. 3. A significant change in appetite, eating much less or more than usual, and/or weight, notable loss or gain, unrelated to dieting. 4. Sleeping too little or too much. 5. Decreased energy or increased tiredness or fatigue. 6. Increase in purposeless physical activity. For example, inability to sit still, pacing, hand-wringing, or slowed movements or speech that are severe enough to be observable by others. 7. Feeling worthless or excessively guilty. 8. Difficulty thinking or concentrating, forgetfulness and/or difficulty making minor decisions. 9. Thoughts of death, suicidal ideation or suicide attempts. Medications and psychotherapy are effective for most people with depression. Selective serotonin reuptake inhibitors, for example, fluoxetine, sertraline, paroxetine, citalopram, escitalopram, are the primary medications prescribed owing to their relatively mild side effects and because they are less toxic in overdose than other antidepressants. A patient with 2-month history of low energy, weight gain, insomnia with early morning awakening, impaired concentration, forgetfulness, and loss of interest is most consistent with major depressive disorder. Some individuals with major depressive disorder do not report feeling depressed due to poor recognition or concerns of stigma, and may come to their primary care physicians with excessive worry over physical health, pain symptoms, for example, muscle aches, abdominal cramps, headaches, and other somatic symptoms, for example, fatigue, sleep disturbance, appetite change. When medical illness has been ruled out, major depressive disorder should be considered high in the differential diagnosis of patients with these symptoms. Some signs and symptoms of major depressive disorder are identical to those of a general medical condition. For example, weight loss and cancer, fatigue, and hypothyroidism. Depressive disorder due to another medical condition is diagnosed when there is evidence from the history, physical examination, or laboratory tests that the symptoms can be entirely explained by the physiologic mechanism of another illness. Patients with major depressive disorder can have worry and psychomotor agitation, for example, restlessness, fidgeting. However, generalized anxiety disorder is characterized by multiple worries, not just health anxiety, lasting more than 6 months. Illness anxiety disorder involves an extreme level of worry about having a serious illness, followed by excessive health-related behaviors for 6 months. Somatic symptom disorder involves a focus on the seriousness of bodily symptoms with excessive thoughts, anxiety, or energy devoted to them for more than 6 months. Somatic symptoms and related disorders are not diagnosed if they arise only during an acute depressive episode. Diagnosis of major depressive disorder: more than 5 of the following symptoms lasting more than 2 weeks. At least one symptom must be either depressed mood or loss of interest, pleasure. Depressed mood, loss of interest or pleasure, change in appetite or weight, insomnia or hypersomnia, psychomotor retardation or agitation, low energy, poor concentration or indecisiveness, thoughts of worthlessness or inappropriate guilt, recurrent thoughts of death or suicide, no history of mania or hypomania, not due to substances or another medical condition. Major depressive disorder can present with loss of interest or pleasure without depressed mood. Patients may seek treatment in the primary care setting for somatic symptoms such as fatigue, sleep disturbance, and pain.